Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for today is medication adherence among patients with corneal diseases. I'd like to thank our host, Dr. Tom Quinn, our topical editor, Dr. Kelsy Steele, and our topical expert, Dr. Kate McClure. And now, over to you, Dr. Quinn.
Greetings, all of you of curious minds, to this episode of the Clinical Podcast Series. We're going to start off here talking about management of corneal disease and patient adherence to medications. This is a paper that was presented in the publication Cornea in December of 2021, authored by Miriam Khan et al. And here to discuss this with us is our expert, Dr. Kate McClure, who is in private practice and also on clinical faculty at the Ohio State University College of Optometry, where she got her optometry degree and did a fellowship in cornea and contact lenses. Welcome, Kate.
Thank you, Tom. I'm so excited to be here.
You are the perfect person to have to discuss this paper with the focus on the cornea. So tell me what the whole deal here is. What question were they trying to answer with this paper?
Yeah, so I found this paper really interesting. In this paper, they wanted to explore medication adherence. More specifically, they were looking at the patterns of eye drop adherence among patients with corneal conditions, different corneal conditions, transplants, microbial keratitis. So there was really a vast variety. They wanted to quantify the prevalence of medication non-adherence and identify the potential reasons, which I think is really important.
Oh, yeah. Why do you think that's important?
So, there's really little known about medication adherence for corneal diseases. We often talk about medication adherence and glaucoma. There's studies and papers that have researched that. So I think we know a little bit more about our glaucoma patients, but really there's little known about how well our patients that have different corneal diseases, how well they're adhering to the medications that we prescribe. Okay. And as you know, Tom, with these corneal conditions, it's super important and critical to be using the medication as the doctor prescribes. So I think that this is a really interesting subject to investigate.
And what did they find out?
So they found that younger age was associated with a higher risk of non-adherence. To me, that was maybe not as surprising as I thought, but still it kind of confirms maybe what we already know is our younger patients are less likely to use the medications as we prescribe. And what I did find interesting was patients with corneal transplants reported between a 19 and 66% non-adherence. That's kind of, yeah, that's a big range, which I thought was interesting, but also, patients usually understand that corneal transplant is pretty serious and they don't want to have to go through it again. So I was really surprised to see the range and some on the higher range of non-adherence for corneal transplants.
Kate, what would surprise me is that you think corneal disease, many of them result in pain. And you would think a painful condition that you would have high adherence, but even those showed some poor adherence, right?
Exactly. So that actually brings me to my next point, and that the infectious keratitis patients reported a 46 to 80% non-adherence, which, as you mentioned, that's super surprising and pretty much unexpected, pending that, most of those patients are in pain and are not doing so well. So I thought that was really interesting.
So what did we learn from this paper? How can we take this information and apply it in our daily practice?
So, that's a really good question. I think it just shows that we really need to educate our patients on the importance of using the drops, what they should expect from using the drops, how to use the drops appropriately, and really emphasize the fact that they can't forget doses. So the paper showed that many of the patients just said they forgot or fell asleep. So I think if we spend those few extra minutes just to point out to our patients that they need to use the drops as we've prescribed, I really think that that'll make a positive impact for our patients.
Great message. Thanks, Kate. We appreciate your insights. Thanks for participating. And all you out there, thanks for listening.
Thank you.
And a special thanks to CooperVision for their educational grant to make it all happen.